లేటెస్ట్ న్యూస్ అప్డేట్స్ కోసం తెలంగాణ 99 ని ఇప్పుడే సబ్స్క్రైబ్ చేసుకోండి.
Hi, hello, namaste. Welcome to Telangana 99. Today, on the occasion of Mother's Day, we have our guest, Dr. Tripti Dev, Senior Consultant Interventional Cardiologist at Apollo Health City, Jubilee Hills, Hyderabad, and Vice President of Telangana Cardiologist Society of India. And today, she is going to give message to all the women who are going to be mother and existing mothers, future cardiovascular and hypertension prevention and protection from complications related to the high blood pressure through their journey of womanhood, as 17th of May is observed as World Hypertension Day. Welcome to the show, madam.
Thank
Mother's Day
you.
to you,
Happy Women's Day to you also.
madam.
Thank you very much, Mr. Lakshmikant Reddy. This is a great occasion to reach out to the entire womanhood in India across and the world across, because as you know, every mother, every woman is going to be a future mother or going to take the responsibility of motherhood, not only for their own children, for their entire community and the society. As you know, that one can never return mother's love, and a few relations are beyond words, that is the motherhood and the concerns. Hence, this is our great responsibility as the cardiologist and as the vice president of the Telangana Society, Cardiologist Society, to reach out to the community and make them aware of the diseases burden for the womanhood and how a womanhood can be prevented from getting into any cardiovascular, heart related or high blood pressure related complications. These are all preventive notes which I want to spread out to the all women in the community. And the awareness comes only from the knowledge. As we know, the knowledge brings us the kind of understanding, and from there we can start knowing the facts that Indian women as well as worldwide, the women die more commonly than men because of the complications of high blood pressure, which are related to entire journey of their life, right from the childhood to the 85 years till the death, because woman has many exclusively different kind of hormonal changes, as well as in their journey they have many challenges which they have to carry through their entire life, which men they don't carry in their entire life. If we talk about the prevalence of high blood pressure in women as a child, then you will be surprised to know that children also get high blood pressure as a female or as a male also, but the prevalence in female children and adolescents are more than the men. Now coming to some of the statistics, that which woman is likely to develop these kind of blood pressures, the prevalence, females in India, that is the current study indicates that about 1 in 10 women in the age group of 15 to 49 years suffer from high blood pressure. The overall prevalence was found to be 11.3% in India. This would amount to an estimated number of around 282.5 million of hypertensive women in the reproductive age requiring health care services. So this is a great challenge and responsibility on the community services as well as for the protection from the cardiologist and the physicians and the general family physicians' responsibility to understand this kind of vast, that is tremendous amount of load on the community for such a high numbers of hypertensive women in the society. Then what is blood pressure? First of all, we have to understand why we talk about this blood pressure and when we call that a woman or an adult has got high blood pressure. The categories of blood pressure for men at the age of 18 to 39 is more than 119 by 70. That is more than 120 by 70 should be taken as a normal blood pressure for 18 to 39 years of age for men, and for women it is less, that is 110 by 68 millimeter of mercury. This is normal. And for 40 to 59 years of age, it is 124 by 77 millimeter of mercury, and for women 122 by 74 millimeter of mercury. And above 60 years of age, the normal blood pressure for a man would be 130 by 70, and for a woman would be 140 by 70 millimeter of mercury. That means if you see the post-menopausal age above 60, women develop more blood pressure as compared to men. So this is the common prevalence and the common normal blood pressure. But if this pressure goes beyond this level, that is above 130/80 for any group, any age group from 15 to 80, then we call it pre-hypertension, more than 130/80. Then more than 140/80 is stage 1 hypertension. Then more than 149 by 89, stage 2 hypertension. Then more than 150 by 89 or 99 is stage 3 hypertension, and beyond that it is severe hypertension. And these numbers are not related to any age group. Any age group will have these numbers as their hypertensive categories in the their own health. So this is to be understood. Most of the time in general public, when we see Mr. Lakshmikant, that people are not aware of this. Till 140/90, 150/90, they think that blood pressure is normal according to their age group. But it is not like this. Even young children, 15 to 18 also, if their blood pressure is more than 110/70 or more than 120/80, in that range only they have to be taken as a pre-hypertension. And the prevention starts right from the childhood. If you want to ask me at what level we should know, so I would suggest in this society to prevent even young women from high blood pressure complications. At the age of 10 years, every school child should be screened for blood pressure. You would be astonished and surprised that in India there are studies in Chandigarh and in the south also in Kerala that young woman, that is 10 years of age of child having high blood pressure. 1 minute. हेलो हाँ कितने बजे बुला रहे? 10 o'clock में आती हूँ, थोड़ा जल्दी आती हूँ. Okay, thank you.
Yes, madam. Yes, madam.
So
You are telling about study in Kerala, and yeah.
The story of Indian children from the 10 years of age in the school study, they have found that the prevalence of high blood pressure in the children is astonishingly high, which you don't know, that somewhere from 9% to 11.9% of the school children having high blood pressure from the age of 10 to 18 years. And that is mind-boggling. This is a very high number, which we never understand and which we never think also that the prevention should start right from that young age. They should be given the entire lifestyle modification, how to eat, how to prevent obesity, how to control their diet and their salt intake. And every child should be given 2-3 plates of fresh fruits, salads, greens, and sprouts, the natural way of taking the diet, not the high in content of salt and the confectionaries and the tinned and the bottled items. Like children, they take a lot of Pepsi, Cola, and all these Sprites and all, and they take a lot of fried stuff like fries and all, French fries, and they love those things, the burgers and the pizzas and the all commercial items, and that causes high salt intake, and that causes early childhood. And nowadays, children are not having the proper exercise also, and they are sitting as a pouch potatoes, or they are all the time hooked on to the uh, this. We see all the time children are looking at the mobiles also, and this mobile addiction. And the parents should understand now to prevent the high blood pressure, not only for them but for children also. So from there, the children could be prevented to get the early complications of high blood pressure. Then what happens to these girls, those who have high blood pressure and those who have obesity for their age and height? They develop PCOS. PCOS is polycystic ovary disease, and that causes this syndrome. Polycystic ovary syndrome causes many problems. That is metabolic syndrome, high cholesterol, high blood pressure, obesity, and these children have got problem in their future life also. When they want to become pregnant, there is problem with the pregnancy. So these are all things which we are facing in the community. So if you look into the real challenges we have in India, from where to start? Like we said, school education, school counseling, and school screening. Entire school should be screened for understanding. Then second stage comes when they are in the colleges. And there also, there is no one nowadays to look at their health. After the age of 18 to 25 years, very formative years where your vascular tree and the vessels are getting into maturity. And at that point, if you have high blood pressure, you develop very high risk of heart attack, cholesterol deposition, and heart failure also. So this is how the metabolic syndrome, which causes more cholesterol, more stiffening of the arteries from the age of 25 also we are seeing nowadays. Not only for the women, but for the men also. But for women, it is special challenge because starting menarche, that is from the hormonal changes, which a woman or a child goes through by the age of 13, 14 or 10 to 12 years. There itself, there is a lot of challenges they have to face through the children and the young adults and the teens, so that they get more, blood pressure, not only blood pressure, more cardiovascular challenges and risk and stress to their mental and physical health because of hormonal changes. So teens at the age of uh, 10 to 15 years or 18 years, as a child, as a girl child, gets more stress, not only for their studies and the challenges in the community as a female, plus the hormonal challenges, and that puts them into a real stress for the future development of cardiovascular disease. And now we talk about a child who gets uh, after the age of 20, 25, they get married, and after the marriage, what are the challenges nowadays? Presently, a woman has to go through all these treatment paneling for the PCOS, that is polycystic ovary syndrome, and where they become infertile because there is fertility problem. Then they go for high hormone intake to improve their fertility. And these hormones, which are estrogen, progesterone, and the oral contraceptive pills, that puts a woman into the early onset of high blood pressure, because oral contraceptive pills will cause more high blood pressure. And that is why we should make them understand that not to just take a pill without consulting a gynecologist or a cardiologist or somebody who can take their journey much safer. So they should be counseled by the proper physicians and the family physicians before they start taking their own, unprescribed or prescribed drugs, which can put them into high stress of high blood pressure and the problems of hormone intake as well. After this stage of pre-pregnancy, the preparation for pregnancy and the pregnancy. Now coming to the pregnancy, every woman who goes through pregnancy nowadays is supported by a lot of hormones, because the natural pregnancy, the intensity of the natural pregnancy has come down, the incidence, because of the late marriages, because of the lot of community, the society, and the environmental related challenges like pollutions, and then we have a lot of pollutions in the diet, and the lot of problems in our intake of fresh fruits and all. So these women, they get gestational hypertension. That is, gestational hypertension means pregnancy related high blood pressure. And what are the reasons for that, and how we can prevent a pregnancy related high blood pressure? And there are causes. So how can I prevent hypertension during pregnancy? This is a question. Once you prevent it, then you can have a natural pregnancy through a natural delivery and a healthy child, because a child's life start, a baby's, from the utero, from the womb. And from the womb, the baby starts getting these side effects of high blood pressure, which mother is carrying. And from there, the risk of baby to develop early high blood pressure starts from the fetus life, that is, baby is in the womb of the mother. From there, the baby gets challenges. So what are the causes? Now we talk about that the women who use extra salt for taste in their diet, they are prone for high blood pressure during pregnancy. They drink at least less than 8 glasses of water. They should use more than 8 glasses of water, or 10 to 12 glasses of water during pregnancy to flush out and to prevent hypertension. They increase the amount of protein to intake rather than carbohydrates, and too much of fast foods, etc., and junk foods, etc., they should not take. Then they should get enough rest. The woman should get enough rest during pregnancy to prevent high blood pressure. That is 8 to 10 hours of sleep and intermittent rest in between also, even their working hours also. Then exercise, they should walk regularly, at least 5,000 to 10,000 steps, and they should do normal stretching, breathing, yoga, pranayam, all those pregnancy related yogic exercises. And they should elevate their feet several times in a day to keep their feet up, at least 2 hourly, 10 minutes like that, to get more circulation to the uterus and to the baby which is in the uterus. And the first, then we talk about if you have high blood pressure during pregnancy, then what can you do to prevent further challenges or further injury from this blood pressure to your system? So this is known as pregnancy-induced hypertension, is called as toxemia or preeclampsia. And these words are used by the gynecologist, and that can be further reversed or it can be prevented. So it occurs most often in young women with the first pregnancy, or it is more common for twin pregnancies, like as multiple pregnancies, because the woman's circulation is more challenging with that. And the woman who had pre-eclampsia or toxemia or PIH in the previous pregnancy, they are more prone to develop the high blood pressure for the next pregnancy. So what is the prevalence of high blood pressure during pregnancy in India in the females? The studies have shown that the current study indicates that about 1 in 10 women, that is a very high number, in the age group of 15 to 49 years, suffer from the high blood pressure during pregnancy, and overall prevalence was found to be 11.3%. That is more than 1 in 10 women having this problem of high blood pressure during pregnancy. And this would amount to an estimated number of around 280.5 million hypertensive women during their pregnancy in India. And that causes a real thought-provoking statement from my side to the society, to the government, to the all, the health professionals, and to the health providers, to the community, that this boggling number should go to the institutions, to the preventive societies, so that every woman should be checked during properly, not only in the the urban community, but in the villages and in the remote villages also. They should be told that regular blood pressure checkup and prevention is very important for having a proper pregnancy, proper childhood, and for the fetus, for the small baby which is there in the mother's womb, should not get the effect of the high blood pressure when this child is born of a high blood pressure mother. The child gets into many trouble. This child is supposed to get more high blood pressure, early high blood pressure in their early childhood. And that is how this is a big circle, big cascade. And this protection can start right from the mother itself, so that the mother can be prevented to have all these complications during pregnancy. So the next generation, the next childhood will be protected. That will be our future progeny, future children will be having better health and less high blood pressure. The prediction of high blood pressure for women by 2030 is going to be just double for now, what is present in now. And that is a very sorry state of affairs we are going through in our community, because nobody is taking any responsibility for understanding and for protection, pro health protection and prevention in the entire society. So we have to go out to reach to them and understand this and make them happy.
Madam, while pregnancy, many female, we generally see there is elevation in high blood pressure. So it is going to be continued for the rest of the life, or only for the pregnancy period only it will be?
That is a very good question, Mr. Lakshmikant Reddy, because after having the pregnancy completed, mostly these blood pressures which are high during pregnancy, they gradually subside for the next 6 months' time. But in our practice and in our studies, we have seen initial regression of the blood pressure after the pregnancy may not sustain for a long time, because these women, they are prone to develop further high blood pressure, and which is the mistake they do mostly. So they should be regularly monitored, because 25% of the women, once they finish their pregnancy and become mothers, they can have persistent blood pressure in the future. Rest 25% may have complete regression. Rest 25%, another 25% may have late development, means after 6 months, 1 year. And some of those who have very high blood pressure may not even get regression. They should get complete treatment throughout, even after the pregnancy is over, to the next, up to the next pregnancy or up to the next this one. So that I have seen the people or the women or the mothers, they forget to get their blood pressure checked. And after the childbearing age, means once the baby is born, they think their responsibility is to look after the baby. And they forget. The most of the mothers, they neglect themselves. They forget themselves. What do? They try to take care of the baby first and the family first. And they are themselves neglecting themselves. By the time the very high blood pressure is detected after the childbearing age, that is too late also. There are complications of high blood pressure which woman is already suffering. So I would suggest and I would give this message to the community that please continue to check blood pressure at least once in a month after the pregnancy is over. And nonetheless, if you can do it once in a week or once in a month, minimum, to have the blood pressure known and checked and controlled less than 120/80 for a young woman, and for an elderly woman less than 130/80. And this goes along with the diabetes also. Nowadays we are seeing gestational diabetes along with blood pressure, and these two are metabolic syndrome, and they are more prone to develop early diabetes also. Early heart attacks, women get early heart attack, early atherosclerosis, early blockages of arteries, early brain stroke, heart stroke after the pregnancy is over. Those who have gone through diabetes in the pregnancy and diabetes during the high blood pressure during the pregnancy. So these are all watchful dog kind of thing, processes where we have to be very alert for them, so that all these complications, future complications, can be prevented much earlier than to suffer these problems.
Madam, hypertension in the females at the age of post menopausal, how it is in these ages?
This is again a very big challenge for a woman, because during menopause, what happens? There are a lot of hormonal changes. Mostly a woman who is protected by estrogen hormone throughout their journey of life, at prior to menopause, the estrogen gets much lower in number, means the value, the amount of estrogen in the body, that slowly comes down because there is no ovulation, there is no ovary to protect the estrogen in the this thing, woman's. Estrogen is a hormone which causes vasodilatation and the vessels become much more relaxed. But after the estrogen is withdrawn, only progesterone, then we can see that there is combination, means there is more response to high blood pressure. And these women after the menopause, they have withdrawal of these hormones. The other hormones which are overdriving, male hormones like testosterone or other hormones like corticosteroids, etc. So they get more high blood pressure, prone to high blood pressure after the menopause. And that is why perimenopausal period, we say, there is syndrome of, hot flashes, sudden vasodilatation, disbalance of the hormones, and they are not able to sleep also, like sleep deprivation, anxiety, palpitations, and they get high blood pressure intermittently initially. It's not a sustained. Then gradually it becomes sustained when they are not able to cope up with the hormonal changes. So every perimenopausal woman should get checked properly for the high blood pressure, for the cholesterol, for the sugar, everything, because that is the period when they gain weight also after the menopause or pre-menopause. Because of the hormonal changes, weight gain is there. Then there will be a lot of psychological stress where they would start eating more junk food because of the stress, to relieve the stress. And that can cause a definite challenge to the woman body at perimenopausal period. And we have seen first time getting stroke, first time getting heart attack more, and first time getting cardiovascular complications like heart failure. That is the time from the 45 to 65 years of age, that perimenopausal period is very challenging. And if they are watchful, if they take regular checkups at that time from 40 years onwards, a regular checkup every 6 months, 1 year, then all these things can be prevented, because numbers of their, how blood pressure is governing their body, how the effect of cholesterol, effect of sugar, all those things, metabolic factors, we can understand and we can prevent them from getting into these complications. So this was a major question which you asked, very good question, and very important for every societal woman to understand. Now, and I have seen in the villages mostly, they are given some small tablets for the blood pressure from the primary health center doctors. But as soon as their blood pressure is under control, that means it has come down to 110/70, 120/80, somebody will stop the medicines. Because there's a mindset for a woman that no, medicine is not good in India especially. They think we should not take medicine. As less medicine we take, that is more healthier we are. That is how they come and tell us. No, madam, I have never taken any medicine till now in my life. How you are prescribing so many medicines, and we don't want to take these medicines, and they don't want to check their blood pressure also. They said, no, we are fine. I have no symptoms. Till they get something like headache or some giddiness, some dizziness, or some breathing, palpitations, there is always end organ damage started, because blood pressure will cause end organ damage. Like their retina will have some problem, the retinal hemorrhages, or brain will have some, the vascular injury, the small vessels or constrictions, and their heart will have, the heart will become balloon dilated because of high blood pressure, and the kidney will get affected. So till the time when they get some organ damage, till the time they don't want to accept that they are sick or they have to take medicine. Medicine means sickness. That is the mindset. They never take medicine for a prevention. Like we see, no, you take a small tablet and keep your blood pressure between 120 to 130. That is our range, 110 to 130, not beyond that. But to take that small tablet also, they will have so much of discussion, so much of, they will get strained and stressed. No, I am getting sick. That's why doctor is giving me a pill. Without sickness, you don't take a pill. That is all. There's no concept of prevention for certain things for which we, not only lifestyle, that is of course a very good thing to have a good lifestyle, but along with the lifestyle, they have to take a small tablet to persistently keep their blood pressure round the clock 110, 172, 120, 80, max 130, 80, not beyond that. But nobody listens nowadays. Yesterday, I had a patient in my clinic and she was vehemently against taking one tablet. No, madam, my lifestyle is very good. I never take any junk food. I take only fruits, salads, and all greens and vegetables. You have to see that some Ayurvedic medicine you give me, I will take. Then they are happy. Some homeopathy medicine. They don't want to challenge their body with this. They say it English medicine. That is what they call it. English dawai. Madam, हमको English दवाई मत दो.
Yes, madam.
Like that.
Okay. Thank you, madam, for taking time and on this Mother's Day by giving your inputs and suggestions for females, like from starting teenage to we discussed post-menopausal effect of hypertension in females. And once again, happy Mother's Day to you, madam. And once again, we will come with another topic. Thank you for joining, madam.
Thank you, Mr. Lakshmikant Reddy. You are a great, provocative. Means you are a great propaganda you are doing for the society, and you are trying to make so many women happy by doing this kind of webinars and to reach out to the community and making them happy to understand and aware. I hope I could do it in Telugu also, but
we will try, madam.
You can make it in Telugu also. Same thing with somebody who can, same thing can translate to Telugu to reach out to the community. So I'm so happy for you to give me this opportunity to come from Telangana Society of Cardiologist Society of India to give this message to the entire community that woman is more important for a family, for the society, and for the childbearing, for their future generations. The nation is healthy. The woman is healthy, the nation is healthy.
Thank you,
That is my message.
Thank you, madam.
Healthy woman, healthy nation.
Yes, madam.
Healthy mother, healthy nation.
Yes.
That is all.
Thank you, madam. Thank you for joining.
ఈ వీడియో గనుక మీకు నచ్చినట్లయితే తెలంగాణ 99 ని సబ్స్క్రైబ్ చేయండి అండ్ నోటిఫికేషన్స్ కోసం గంట కొట్టడం మర్చిపోవద్దు.